So thank you very much, Toki. Thank you, Meredith, for organizing this. Thank you, everyone, for being here. It's an honor to be sharing the floor with Diane, not really the floor, but sharing the space with Diane. So this is a work that is an ongoing project, and I'm very excited. So I'm very happy actually to present this to you. So what's going on? What we try to do here? So if you think about, say, the pandemics, over the days as the pandemic progressed, many countries introduced non-pharmaceutic interventions, right, to enforce social distance, to control people to not go out, and basically control the spread of the disease. And then, you can think about the timing being heterogeneous across countries because the pandemic was affecting the countries in different timing. But if you think about many countries, so most of the countries actually introduced some types of this social distancing measure, right? Like school closure, workplace closure, and so on, right? So, so that has been implemented in most of the countries. One thing that has been quite heterogeneous across countries is really how the leaders of the country, like the prime minister or the president, they have dealt with the problem, right? So you can think one side, there is one extreme case would be, say, Macron, who said basically this is the biggest challenge of a generation. And let's, this is a war, this is almost like a war against coronavirus. And in the other extreme, you have, say, Trump and the president of Brazil, Jair Bolsonaro, who basically minimize the virus, minimize, the problem that has been caused, and so on. So what we're trying to do here is basically we are trying to understand how the speech and actions of a leader affect social behavior of individuals, even in a pandemic. And that's a very hard, if you think about, a very hard exercise because there are many policies going on. There are, this non-pharmaceutic intervention, but there are always like the social behavior of the people, right? So one colleague of mine, Flavio talks about it. He has a paper on equilibrium social distance, how people, they change behavior, right? Choosing actually their own action once they face the pandemic. Right? So there are many things going on. And we want to isolate basically the role of the leader in terms of speech and action during the pandemic. And that's what we are trying to do. And that's a joint work with Nicolas and Danielle. They are both assistant professors at Vargas Foundation. So this is basically the question. If you think about the research question is, could leaders' example and words drive behavioral change among citizens on top and above incentives, right? And institutions, even during the pandemic. So that's basically the question that we are trying to address. And we are going to look at Brazil. Brazil is a very interesting case, right? So I'm going to explain why Brazil is a very interesting case. But this is a picture of the president, Bolsonaro. This is on FT on 16th of March. And there's a picture that was taken one day before, on Sunday, and he's giving high fives, as you can see. The first COVID case in Brazil was recorded on 26th of February. And basically, he is with some possibility of being infected. And the reason was he had an official trip to the US on the week before this public demonstration, where many members of his cabinet actually tested positive for COVID-19. And he was waiting for one of the tests to be released. So he's giving high fives on this public demonstration. And I'm going to go back to this picture later on. So just hold on a little bit and talk a little bit about the context of Brazil. So what's going on in Brazil? Brazil is a federal system. There are 26 states and the federal districts, that's the capital, Brasilia. And there are more than 5,000 municipalities. Okay? So, and basically Brazil is, as you probably know, very polarized. There are very strong support to Bolsonaro and also very, weak support for him in some of the municipalities. And what's interesting is that the states, the Supreme Court ruled that the states, they have the power to actually introduce this social distance measure, right? So the states actually, they have the power actually to introduce this social distance measure. And Bolsonaro, on the other hand, he has encouraged people actually to go out, he joined rallies, and he basically was contradicting even his health ministry, right? He actually sacked 2 health ministries during the pandemic, and against also some subnational social distancing measures. Okay? But if you go to the context, there are lots of things written, don't worry about, I'm not going to read everything, but I'm going to highlight the main points. If you really look at the time and the context, what was going on, the message has not been uniform over the period. In fact, if you see this official pronouncement, the official pronouncement, I'm going to go back to it. It's very important because it's televised to all TV channels, and also all the radio stations they have actually to show this speech. And on the 6th of March, he basically started to talk. That's the first one he mentioned, the COVID-19, and he basically says, as you can see, people must strictly follow expert recommendations on the best protective measure. So this is actually a message against, or in support of social distancing, right? And on 12th of March, he appeared on TV. This is more an informal appearance. He does this live for, some of his supporters on 12th of March. He was wearing a mask again, because he came back from a trip in the US and he was with some possibility to be infected. And there was scheduled this public demonstration, these rallies in his support and against the Supreme Court and the Congress, that was scheduled for 15th of March. That's a Sunday. And Bolsonaro, on the Thursday, just before the 15th of March, besides his Minister of Health, and then basically he asked the Minister of Health, what should we do with this public demonstration that's probably going to happen on Sunday? And then the Minister of Health says, we should cancel that, we should postpone that, right? And there is, some, anecdotal evidence that on Saturday, he actually has sent from his own WhatsApp account a message to his supporters actually to go to the streets. And the demonstration really happened on 15th of March. And that's the picture that I have shown. After that, he toned down the voice against social distance. There is another speech official pronouncement in 18th of March, and he toned down the voice against social distance. He actually was saying basically we should follow the experts' views on this. But on the 24th of March, that's another one that I highlight. There is again this official pronouncement, and that's the one very strong against social distancing, saying schools should not be closed because kids or children, they are not really affected by the disease, and also he praised the effectiveness of this anti-malaria chloroquine medicine as a medicine that's effective against the disease and so on. And even he said, given his historical athletic condition, the virus would be a minor flu. And then since then, the message has been always, in some way against social distancing. And that's the 2 pictures. That's the one that I come back. This is a selfie, and this is 15th of March. He picks up the phone of his supporter. He took selfies and gives back, and so on. And this is 24th of March, right? So that's a Folha de São Paulo. That's one of the main Brazilian newspaper, and that was on the day just after the official pronouncement on 24th of March, and basically say Bolsonaro criticized school closure and attacks the media, right? So that's basically the message that is there. And that was highlighted in all Brazilian newspapers, okay? So what we're trying to do, we're trying to get, on top of all the state school closure policy and so on, workplace closure and so on, we're trying to get what were the effects of these two messages that Bolsonaro gave that were very strong against social distance. That's really what we are trying to capture on the behavior of individuals. Okay? So how do we do that? We get this granular geolocalized mobile phone data. That's 6 million of anonymous devices from a company in Brazil. And with an algorithm, they basically define what's home of this particular device and see how the device changed over the period. And we combine this data with the support to Bolsonaro. There are many ways that we can do support for Bolsonaro. I'm going to just show some. One of them that is our main kind of a specification is really these pro-Bolsonaro municipalities. That's the municipalities where he had more than 50% of the votes in the first round of the election. Brazil, there are 2 rounds of election. In the first round, there are many candidates. In the second round, only the best 2, they go for the final vote. And in the first round, if a municipality had more than 50%, they basically, that's really the support for Bolsonaro. And that's this is the social distance measure before and after the pandemic. As you can see, the light areas are the areas where the social distance was low. And then as you can see, people actually change behavior, social distance becomes stronger. But there was heterogeneity across, the municipalities. And that's really what we try to explore. Okay, I'm not going to get into the detail of the equations or so on. So what we are trying to get is this treatment, which is really the speeches together with support to Bolsonaro to see whether or not these places, they actually behave differently. I'm going to show some of the results, okay? So this is the main result. So if you see this result, this is the average effect on social distancing. And what we are trying to do, we are trying to compare the places where he has strong support before and after the speech. And if you see here, so the time 0 here is basically the 15th of March or 24th of March. If you see before, you see the horizontal line, it means that the confidence interval, that's where the point estimate is supposed to be, is basically all the point estimates 10 days before is really crossing the 0 degree line, right? So it means that there is not really statistical difference from 0. But after the speech, you can see basically that after the day 5, you can see that this is started to be statistically different from 0, meaning that the places where Bolsonaro had more support, social distancing decreased relative to the places where he doesn't have strong support, okay? So this is one effect. Another effect that we see here is basically the same kind of approach, but the definition of what is pro-Bolsonaro is different here. Because some of the states, no municipality voted for him. So we lose a lot of variability across the state variability. So here we basically say, within a state, what are the municipalities that voted above the median for Bolsonaro and what were the one that voted below the median for Bolsonaro? And that's really how we define the pro-Bolsonaro within a municipality. And if anything, as you can see, the effect is stronger, okay? And finally, to not take much of your time, so there is another one that I wanted to show is that within the pro-Bolsonaro municipality, this is only with where he actually, the states where he won in the first turn of the election. We look at the municipalities where above the median with below the median, and we see that actually the effects even stronger, okay? So we do a placebo analysis, which basically the placebo says, let's look at the events that are unrelated with the social distance message, either the actions or the speech. And we basically look at some of these official pronouncements. As I said, these official pronouncements are very important because they are televised to all TV channels and also the radio channels they have to broadcast. And then basically what you can see is that there is no difference here before and after the speech for the municipality pro-Bolsonaro against the one that they have weak support. So that's basically a placebo analysis showing that our, what we call in economics, identification strategy is capturing really the effect, okay? So we do try to disentangle the overall effect into, what are explaining these effects. We look at, say, media penetration at the municipalities, seeing the use of Twitter and also TV channels that are broadcast in each of the municipality, and we show that the effects is stronger, which is consistent with, our way of thinking of how this affected individuals. We also show that the municipality where the fraction of evangelical is stronger, is higher, the effect is actually stronger. And the evangelicals are a religious group that's, support a lot Bolsonaro. And also we show that the municipalities where we have active workers, male between 15 and 64 years old, then the effects are also kind of stronger. Okay, so quantitatively, what does it mean? So if you do some back of envelope calculation using our estimates and also support for Bolsonaro, we basically show that for every day after one of these two events, for the 10 days after, and each of the day, about 1 million people were out of their house, and the radius is 450 meters of their house during each of these days, right? So that's basically the quantitative implications of that, right? So we show, for instance, that in some municipalities where support is the top 5 municipalities in his support, from February to April, it increased, social distance increased in 24%, while for the bottom 5%, it increased by 31%. So there is a 7 percentage point difference, right? So we also report evidence on shifts in trend in reported cases and also COVID deaths. But these data are not very good. So that's why we are not paying much attention on that. Instead, we are looking at official deaths to basically calculate excess deaths in the periods, right? For each of the municipalities, to really trying to disentangle the effects of these and cases and deaths, right? We are also looking at hospital utilization and so on, right? And there are 2 other variables that we are looking at trying to get transaction data from banks in Brazil to see maybe there is this trade-off of, say, health and economy, that, you affect some health, but maybe the economy is better, or maybe there is no trade-off whatsoever, okay? But this is still to come. And we already have data on forest fires to see the dynamics of the fires in the Amazon and other places during this pandemic, okay? So basically that's the conclusion. So leaders, example, and words on top of, regulation and institutions, they can have a strong effect. I don't think this is only valid for Brazil. There is anecdotal evidence whenever Trump, for instance, said that injecting bleach, can cure COVID-19. There was like a search of people in the search for bleach, and also people buying. So Amazon actually reported a peak of people buying bleach in Amazon. Okay, so that's more than the case of Brazil, and I think more than the case of pandemic. But I think this is a very nice way that we disentangle exactly the role of the leader in terms of speech and action. Thank you, Mary.